We spent a little time on the liver, and then the liver's little buddy is the gallbladder. So I said you can't live without your liver. If yours goes bad, you got to get a transplant. You can live without your gallbladder. So if yours goes bad, a lot of times they remove it surgically. So lots of different gallbladder disorders, and they all start with the suffix chole. So cholelithiasis, very common, gallstones. Lith is stone, and chole is gallbladder, and iasis is condition or disease. So got rocks in your gallbladder. Calculi, or what they're called, calculus is one of them. Solid material that forms in the bile. There are different types of gallstones, and we'll talk about them in a second. Cholecystitis is inflammation, inflammation of the gallbladder and the cystic duct. The cystic duct goes from the gallbladder to the common bile duct. So just inflammation. Cholelithiasis can cause cholecystitis. Cholangitis is inflammation related to infection of the bile ducts. So that's usually some outside agent or an opportunistic pathogen that infects the bile ducts. Choledocholithiasis, it's not a great word, obstruction by the biliary tract by gallstones. So the biliary tract goes from the liver to the gallbladder. And so basically it backs up into the liver and causes problems. So it can cause inflammation of the liver, hepatitis. It's not viral hepatitis, but it can cause that. So gallstones vary in size and shape. They form in the bile ducts, in the gallbladder, or in the cystic duct. And about 80% of gallstones consist of cholesterol or bile pigment. About 20% of people, they get mixed contents with calcium salts. Calcium stones tend to be smaller and pointier and so more painful. And cholesterol stones tend to be bigger and cause more obstruction. Small stones can be silent and just excreted out into the bile. If they're big enough and pointy enough, they could cause pain. Larger stones often obstruct the flow in the cystic or common bile ducts, and they can cause severe pain, which it has a very predictable referral pattern to the subscapular area. So a lot of times people think they're having shoulder pain, and it's really caused by gallstones. So there are some risk factors for gallstones. Being female is one of them. Women are twice as likely to develop gallstones. If you have high cholesterol, or you are have a genetic tendency towards high cholesterol, that can cause gallstones. Obesity, multiparity means you've multiple pregnancies. Use of oral contraceptives or estrogen supplements. Hemolytic anemia, alcoholic cirrhosis. So alcoholic cirrhosis can mess up the whole business. And biliary tract infection. So lots of different risk factors for gallstones. You can see these are little pictures of different types of gallstones. They can be all different sizes, shapes, colors, consistencies. Usually the people don't get treated because they don't know they have stones until there's obstruction of a duct. They get sudden severe waves of radiating pain and sometimes nausea and vomiting, usually nausea and vomiting. If the pain continues and jaundice develops, the bile backs up into the liver and blood. You're risking a ruptured gallbladder if the obstruction persists. Usually, if the stone passes and moves into the duodenum, the pain decreases. You may need to have surgery. Surgery is done laparoscopically these days, which is small incisions, and it's practically an outpatient procedure. You're not staying in the hospital for very long. It used to be a bigger procedure where they had to slice you open, but they don't anymore, so that's good. A lot of times people have a gallbladder attack after a big fatty proteiny meal, and then they're like, oh, I'm never going to eat fettuccine alfredo again, but it's their gallbladder. So jaundice is caused by excessive destruction of red blood cells for whatever reason. Well, prehepatic jaundice. There are different types of jaundice. So jaundice is one of the symptoms of gallbladder and liver disease, and it's gives you a yellow tinge to your skin and your eyes. So it's something that's very visible. It's a lot of times it's not an end stage symptom. It's not an early symptom. It's sort of a middle stage symptom of a lot of things. And so jaundice as a symptom doesn't tell you what it's caused by. It just tells you there's something going on with the liver and the or the gallbladder. So prehepatic jaundice results from excessive destruction of red blood cells, like hemolytic anemias or transfusion reactions, those type 2 hypersensitivity reactions. Intrahepatic jaundice occurs with damage or disease to the hepatocytes of the liver, like hepatitis or cirrhosis. And post-hepatic jaundice is caused by obstruction of the bile flow into the gallbladder or duodenum. So cholelithiasis or a tumor could cause that. So different causes, but it's a visible sign that you can see that clues the medical professionals into the fact that there's something going on with the liver or gallbladder. So on to the pancreas, which is another organ that you cannot live without. So the pancreas is really interesting because it has endocrine cells and it has exocrine cells. So the endocrine cells are the ones that release insulin and glucagon, and the exocrine cells release digestive enzymes. So inflammation of the pancreas could be serious, and one of the problems with inflammation of the pancreas is the pancreas itself doesn't have an organ capsule. And so if there's inflammation in the pancreas, it can result in autodigestion of the tissue. So the inflammation actually damages pancreas tissue. So pancreatitis can be acute or chronic, and the acute form is considered a medical emergency. So if you are having destruction of tissue in the pancreas, it can also progress to tissue surrounding the pancreas, and substances released by the necrotic tissue can cause widespread inflammation because it's digesting the tissues around it, basically. And that can cause hypovolemia and circulatory collapse. So that's why it's a medical emergency, because you could die from it. So you got to get that treated. Chemical peritonitis, which is the breakdown of the cells in the pancreas, can result in bacterial peritonitis and septicemia, which can also kill you. And that can result in adult respiratory distress syndrome and acute renal failure. So the chain of events following acute pancreatitis is not a good chain. Acute pancreatitis can be caused by gallstones if there's enough backup into the ducts, alcohol abuse. You could have sudden onset following an intake of a large meal or a large amount of alcohol. So the next time you go to a wedding or something, think about that. Well, don't, but you know what I'm saying. So signs and symptoms: severe epigastric or abdominal pain radiating to the back. So the pancreas is in the upper left quadrant of the abdomen, just sort of near the stomach, kind of wedged in between the stomach and the kidney, left kidney. The signs of shock for acute pancreatitis are caused by hypovolemia, usually a low-grade fever unless you develop an infection, which then the fever goes up. Abdominal distension and decreased bowel sounds from decreased peristalsis. So the signs and symptoms are pretty clear usually. They do diagnostic tests. They test for serum lipid levels, serum amylase levels, which is one of the enzymes that's produced by the pancreas, hypocalcemia, so lower calcium, and leukocytosis. When they diagnose you with acute pancreatitis, they stop all oral intake. They usually have you on IVs. They treat you for shock and electrolyte imbalances and analgesics for pain relief, because acute pancreatitis is very, very painful. Pancreatic cancer is not the kind of cancer you want to get. I'll just tell you. Well, you don't want to get any cancer, but the mortality for pancreatic cancer is higher than just about any other type of cancer, close to 95%, because it's frequently asymptomatic until it's well advanced, and metastases occur early. So that is a problem. Risk factors include smoking, pancreatitis, and dietary factors. So the adenocarcinoma is the most common form of pancreatic cancer arising from the epithelial cells in the ducts. Early manifestations can be weight loss and jaundice. So those are a little vague. But it's frequently asymptomatic until it's well advanced. So it just doesn't have a very good survival rate.